There are two ways to perform a TBI test with the Newman Medical Cuff-Link Series ABI system. One is through the Cuff-Link itself, which is covered in the CL Owner's Manual and Quick Start Guide. The alternative method will be covered in the following short video showing how to utilize the PPG Kit currently being shipped with all Newman Medical CL level ABI systems. The kit consists of a PPG probe, a DigiDop 300 without probe, a toe cuff, a black hand towel, and a roll of double-sided tape. The audio element of the test will be through the DigiDop, and the Cuff-Link controller will control the cuff pressure and documentation. In the Cuff-Link software, make sure the toe pressure box is highlighted. There cannot be enough emphasis placed on the fact that the treatment room and the patient's toe need to be warm when performing a TBI. This is not only important, but also crucial to obtain a successful test. The lowest successful and trouble-free temperature is about 70 degrees for the digit itself. Often, an additional small heater in the room is necessary to accomplish this. Place the toe cuff with the yellow ankle toe hose connector attached to it on the great toe, making sure it fits well toward the base of the toe. The PPG sensor should be placed against the pad portion of the great toe and securely attached with a Velcro strap so that no light can be detected by the sensor. Sometimes in a brightly lit room, the PPG sensor can pick up ambient light, which can cause it to beep erratically. If this happens, drape the supplied black hand towel over the foot. Be sure not to overlap the toe cuff with the sensor strap, as this can dislodge the sensor when the cuff is inflated. Turn the DigiDop on and wait for the rhythmic, audible pulses to begin. It takes very little air to inflate the toe cuff, so inflate with the controller using short burst with the inflate button. When occlusion occurs, the beeping sounds will cease, and the cuff will begin to deflate at 2 millimeters per second. Allow the air to bleed off. When the audible pulses return, press pressure to document the reading. Sometimes you will run out of toe real estate on smaller patients and may not have room for the cuff and Velcro strap that secures the sensor without overlapping the cuff. If this happens, simply disconnect the Velcro strap as shown from the PPG sensor. Take a small piece of double-sided tape and attach it to the sensor side of the PPG probe. Hold the taped sensor on the toe for a few seconds to ensure adherence and proceed as before, taking the toe pressure reading. There are many users who prefer this application over the Velcro strap method. Also, the PPG sensor can become dislodged from the pad of the toe and allow light to interfere with the signal quality by pulling and tugging on the connector cable. To ensure this doesn't happen, simply create a small stress loop with the cable by giving it a little slack and anchor the cable to the bottom of the foot using a small piece of tape. Once you have completed the toe pressure, press Next on your remote and the waveform portion of the report will be highlighted. Press the waveform button. The toe cuff will inflate automatically. Deflate to 65 millimeters, hold there, and present the waveform taken. If for any reason the waveform is not acceptable, simply press Waveform again to take a new reading. Once finished, Next will take you to the next pressure to be acquired and deflate the cuff.